Hi, I'm Kathy Rhodes. I am a registered nurse and a certified lactation consultant. I currently work at Rhodes Pediatric Clinic, and I'm here to talk to you about breastfeeding. This is one of my passions. It has been for most of my career, which is about 43 years in nursing, and I've helped numerous breastfeeding moms. And one of the things that I hear so much about breastfeeding is a lot of things that people just don't know, or things that people hear about breastfeeding that may or may not be true. One of the things that I hear a lot about is that breastfeeding is going to hurt. And one of the things that we absolutely know is that breastfeeding isn't meant to hurt. It is a natural act. Both mom and baby have exactly what they need, but it is learned. And this is where the help of someone like me, like a lactation consultant, can make a difference in someone's breastfeeding journey. Now, everyone's journey is different than anyone else's. And one of the things that I do as a lactation consultant is I truly respect women's choices, what the family has decided that they want to do. It's not my journey. It's the person that's going through it. And what I want to bring is education. So one of the things that I talk about is, well, does breastfeeding hurt? No, it's not supposed to. And if it does, that's a red flag. That means that you need help. So being able to reach out to somebody that has the knowledge and the skills that can help you make your journey a little bit better, that's what I want to do. The other things that I've heard about breastfeeding is that it's hard to do. Now, that's another myth that's truly not real. It does take a little bit of practice, like I said, but when you think about it, it truly is a natural act. It's been here since the beginning of mankind, and this is truly how we've survived. All of us are mammals, and when we are able to get pregnant, one of the things that follows is that we will make milk. Depending on how our course of breastfeeding is how much milk that we make. When we talk about the amount of milk, it truly is dependent on supply and demand. Your baby will demand it, you will supply it. And that is how it works. But it's the understanding that, well, a breastfed baby does need to eat a little bit more often. Their tummies are so small. And the milk that you make is exactly what your baby needs, even from day one, when you're making that thick, rich colostrum, which is the very first milk that you make. It's so full of antibodies. Even if a woman were to breastfeed just for a few days, she's already given her baby the best start in life because she's given antibodies to her child. After we go through a few days after birth, we produce true breast milk. And most mamas know when that happens because there's many changes that take place with our breast. That's when that supply and demand is really getting established. So when moms say, well, how long does it take for me to get my milk established at the supply that I'm going to need? A good 2 weeks. A good 2 weeks usually is what it takes. And that's why we recommend that unless it's absolutely necessary, and I'm talking about being medically necessary, most babies don't need to be supplemented. No breastfed baby needs water. Your breast milk is 80% water, so your baby doesn't need that. And they don't need to be supplemented with a formula unless your physician has recommended it. There are medical instances where it is necessary, but for the most part, moms have exactly what they need. Now, one of the things that Cenla Pregnancy Center is doing is allowing classes to be offered, and that's what I'm doing. I feel very strongly that every woman has the right to be able to learn about breastfeeding and to really understand what their options are, that again, no woman's journey is just like any other woman's. And there's so many options for a woman. It doesn't have to be exclusive breastfeeding. There are so many other ways that a woman can supply breast milk to her baby if it meets her needs. The Cenla Pregnancy Center is offering a class this August, this month, that will really tie in with what is breastfeeding all about and what are your options. So I look forward to anyone that's able to attend.